And we are live. Really excited. So, guys, feel free and put your questions down below. I'm excited to go over them with y'all here. Akimo writes in, or Akbar writes in, Dr. J, ever since I went on the AIP diet 3 years ago, I've been having severe hypoglycemia symptoms. No amount of proteins and fats make me feel good, as high glycemic foods such as rice. Solution, yeah, you got to dial in your carbohydrates. So you have to look at adding in typically safe starches that are going to be the best source to kind of dive in with first. So safe starches are going to be things like squash, sweet potatoes, plantains, greener bananas. If you can tolerate white potato, fine. Banana, parsnips, rutabaga, turnips. These are all going to be tubers that are kind of starchy, but they're also going to be grain-free. Remember, grains are the seeds of grass that have more inherent inflammation, more gut permeability issues. So doing a starchy tuber tends to be, it gives you the extra carbohydrates you need, but also is pretty anti-inflammatory and may be a really good first step in the right direction. So I hope that helps. CW writes, and does calcium, bentonite, clay, or diatomaceous earth break a fast? I would say no. I would say none of those would break a fast. Nope, I think you're good. Grace writes in, hey, Dr. J, what would you do about infection during pregnancy, after childbirth, and mastitis? So with mastitis, that's going to happen just with clogged milk ducts. There's something called poke root. Poke root is excellent to use to keep the breast ducts open. Obviously, just making sure, breastfeeding every 3 hours, and if you're not pumping is going to be the next best solution. And then poke root is excellent. So hope that helps, Grace. Pink writes in, how to reverse fatty liver. Get your carbohydrates in check, especially fructose. Get your fructose amount under 15 grams per day and good fats and proteins. And, monitor your liver enzymes, monitor your insulin resistant markers like fasting insulin. Get that under control. That's going to make a huge difference in getting inflammation down and getting the fructose out of your system. It's all being stored as fat in that liver. We have about 300 grams worth of carbohydrate or glucose that can be stored in the muscle and about 60 or so in the liver, and fructose preferentially gets stored in the liver. So cut that down, you'll be helped. Ronan writes in, will a DNA test or another test tell me if lectins and other anti-nutrient foods affect me? No, just cut them out. Go on an autoimmune kind of low lectin diet, see how you feel, and then do a very methodical reintroduction and see how you do. That's simple. A lot of tests that are out there, but seeing is believing, meaning actually feeling it and then reintroducing the foods and then seeing how you do. I hope that helps. All right. Also, another study came by my desk today on red meat, saying that red meat, all these years, it is not bad. Like, people couldn't believe it. All kinds of different scientists were writing in saying, well, don't believe it. We have to re-review this study. This was, I think Dr. Christopher Gardner was one of them, a couple of Harvard guys too. And a couple of things came out of it is, a lot of these studies are observational, right? They're people just kind of filling out a survey, checking off the food. We know why these studies don't work well is because when you look at meat, you're kind of lumping in the pepperoni on your gluten-filled pizza as same thing as the grass-fed organic meat from down the street, and we're putting in, the junky meat in the same category. Also, we have to look at the carbohydrate and the alcohol being consumed with the meat. We have to look at burning the meat versus cooking it just right. So you have to factor in all those quality factors and cooking methods. But once you do, or just meat in general has been consumed for too long for it to be an unhealthy food. Old foods don't cause new disease. That's my thesis that I start out with when I look at any research on food being bad. Old food does not cause new disease. And then we have to look at the quality factor, hormones, antibiotics, junk food, where the animal's fed appropriately. And then we have to look at what other foods may be being consumed along with meat. Lots of sugar-filled barbecue sauce, lots of alcohol, lots of grains with it, such as pizza and pepperoni or a hot dog on a bun, right? So you got to factor in all those other variables with it when you do. Old foods do not cause new disease. Would you recommend it preventatively? I wouldn't do it preventatively, but I'd have it on hand. It sounds like you may be pregnant, Grace. If you are, congratulations. In regards to preventatively, I don't think so, but have it on hand. So if you have any issues with it, then you can do that. That way you don't have to go and be on antibiotics, right? So that's really great. And what if mom comes back positive with group GBS is group B strep? Be on probiotics preventatively. Bifidobacter, lactobacillus, that's going to give you the best chance of decreasing any chance of group B strep. So good, healthy, like Bifidobacter, Lactobacillus species are going to do the best. That's awesome. Ronan writes in, what about ketoacidosis that occurs when we eat meat? A friend brought this up to me the other day. Okay, so off the bat, ketoacidosis does not happen from eating meat. Ketoacidosis primarily happens in type 1 diabetics that aren't taking their insulin, or someone that has severe liver damage, typically from cirrhosis. Ketosis is going to be the natural effect of burning fat for fuel. Ketoacidosis is a pathology that happens when ketones go 10 times above nutritional levels. So instead of being at like, a 1 or 2 millimole of ketones, we're at 20 to 30 of ketones. And that typically happens in an environment where there's no insulin at all. Typically a type 1 diabetic that doesn't take their insulin is going to be the most common variable. So what happens is the fuel can't get into the cell, meaning glucose can't get into the cell. So all this glucose is stuck in the bloodstream, and the body freaks out because it is literally starving at a cellular level. It freaks out, overproduces ketones. Those ketones have an acid backbone to it, and that decreases the pH, and that pH, our blood is very pH sensitive, and that puts us into a coma. Hope that helps. Good to know, Grace. Well, wish you the best. K. Gupta writes in, is it safe to eat canned sardines 3 to 4 times a week? Any issues with the tin cans? I'm not too worried about it. I mean, the tin is what it is. I don't think it's that big of a deal. I mean, there's some research showing drinking out of like cans and stuff, you're going to get a little bit. You'll eliminate some as well. I don't think it's that big of a deal. I think the access to good, healthy fish is worth it. And I think canned sardines 3 to 4 times a week are good. Sardines are going to be lower on that scale of accumulating mercury because they're smaller and they have a good selenium to mercury ratio. So canned sardines are great. Best way to increase blood flow to your feet. Any exercise to increase blood flow in that area. Any exercise that's going to involve your whole body, a squat, a lunge, a deadlift, all those are going to be excellent. And then a whole body vibration and or rebounding are going to be great too. Pink writes in, read an article in Natural Medicine Journal about saturated fat increases endotoxemia. So what is a good fat level for keto and primal eaters with a leaky gut? I'm not worried about that. That study was looking at POM. I'm just not worried about that. Endotoxin is primarily going to come from bad bacteria in your gut. So get the bad bacteria cleaned out and eat a really good, healthy diet with macros dialed in for you. Some people do really well at that, 65 to 80% fat. Some do a little bit better with a little bit less and a little more carbs. So just kind of dial in what feels best for you. Don't worry about the endotoxin from fat. That's just not going to be the big source that is going to affect you in general. We'll be getting in touch again soon for prep help before I actually conceive. Detox for sure. Got it. That makes sense, Grace. Miles writes in, hey, Doc, questions about salivary cortisol versus metabolized cortisol. 11.94 versus 3.3354 Dutch test. Hypothyroid. So the 3354, I think that's mid-range on the Dutch. I know I look at the Dutch all the time. I've already reviewed 4 today, but I don't have the reference ranges memorized. I'm pretty sure the total cortisol looks good. The salivary cortisol, 11.94, is that a total? If that's a total, that's very low because typically the low end for salivary cortisol is like around 20. So 20 is pretty low for salivary cortisol, and the metabolized cortisol is mid-range. So I need to see all of those lined up with the reference range just so I have it on top of my head. El Guerrero writes in, I have heavy metals that enter through my chest. I have heavy metals that enter through my chest. Metal piece from bra. Got it. What urban binders? Good detox, heavy metals, cilantro, black charcoal. Yeah, cilantro, black charcoal. You could always do bentonite clay. You could always do zeolite. Those are all really, really good sources. And if it's something mercury-based, which I don't think it is if it's a bra thing, you could do chlorella as well. Romy writes in, the feeling of not being able to take a deep breath, food allergies, or anxiety have been going on for months. That could be an adrenal issue, could be a thyroid issue, could be a mineral issue. You need to really line up everything. The first thing is start with diet. Start with a healthy paleo template. Don't go more than 4 or 5 hours without eating. Stabilize your blood sugar, anti-inflammatory, good proteins and fats. That's the first thing to help stabilize the adrenals and the adrenaline and blood sugar, which helps your thyroid, which helps your hormones. And then start there and then reach out to a good functional medicine doc to get more help. But start there. All right, excellent, guys. Any other questions, let me know. I'm going to go shoot another video here in just a few minutes on a couple of topics I have in mind. If you guys have some good topics and you want to make a recommendation, let me know. I will take that into account. Akbar writes in, is it logical to think the more food reactions one has, the more likely the gastro doc can identify the problem? Potentially, but a lot of times if you're looking at, let's say, identifying some, like let's say celiac, typically you have to be eating that food and create a lot of inflammation. And a lot of times it's not worth it, especially if you already know that eating that food causes a problem. That's enough information for you to already cut it out. Sean Ryan wrote in, last month I completed a 4 million killing protocol, SIBO, CIFO, but still suffering from constipation. I've not retested yet, but taking lactobacillus, soil-based. So number one is you have to make sure HCl and enzymes are dialed in. You have to make sure the food is dialed in too, so like a lower FODMAP template, and you have to make sure that you've done a good test to see what's going on. If it's just SIBO or CIFO, fine, but there could be H. pylori or other things on there. So you have to go through all the 6 R's that I talk about and get it all lined up. What's the maximum amount of rounds of herbal microbial treatment for extremely tough cases? It could be anywhere between 2 to 3 for most people, but you should be retesting in between. I don't think we've been retesting Akbar, so that'd be the next step. You got to reach out. Kelly wrote in, histamine issues are bad. Any food recommendations to help? So I'm seeing a lot of patients, by the way, where histamines are a bigger deal, and it just tends to be this time of year, there's more allergens in the environment. So your people's histamine bucket, people's inflammation bucket is being filled up with a lot of histamine from the environment. So look at cutting out bacon, look at cutting out fermentable foods, look at cutting out citrus and chocolate. Those are really good sources to start out with. What could cause severe itching, especially hands and feet? Could be histamine as well. Same as the last question, all those same foods. A lot of it would just be dependent upon the timing, when did it all happen, what else was going on. Okay, excellent. Any other questions, me y'all? If not, I'm going to jump on and get some more recordings done. So yeah, getting back to that red meat video or red meat article that came out today, really interesting. Old foods don't cause new disease, and we have to look at the quality of the food, number 2, and we have to look at what else is being consumed with those foods. Healthy foods being consumed with a whole bunch of other unhealthy crap could make that meal in general unhealthy. Let's see here, question here from Misty. Misty wrote in, have you treated a patient diagnosed with a connective tissue disease such as scleroderma, aka systemic sclerosis? Yes, all the time. Autoimmune conditions are autoimmune conditions, meaning the similar mechanisms that are present in there are similar mechanisms for autoimmunity present in all autoimmune conditions, and then how the condition manifests is going to be genetically predisposed. Meaning you can have people that just have the exact same similar stressors, and one manifests with Hashimoto's, one manifests with MS, one manifests with scleroderma or RA, or lupus. So they're all different in how they manifest based on genetic weakness or genetic predisposition, but a lot of the same stressors regarding food inflammation, toxins, gut permeability, poor digestion, some level of infection connection, all of those underlying stressors tend to be there. So I've had good success with that, so feel free to reach out below and get dialed in regarding treatment plan. You're welcome, Kelly. Miles wrote in, was thinking about total salivary cortisol, range 10 to 20, metabolized cortisol, 4,500 to 1,000. Mine again was 11. Yep, so very low free cortisol. And then total cortisol was 3,354, which is low. So low total and low free. Yep, you didn't mention, though, the free cortisol in the urine, though. Do you have a free cortisol in the urine marker? But definitely very low cortisol. Are all football players on keto? It depends. I think a lot of football players do good with some level of keto. That job or that type of position work is going to be very glycolytic, so they're probably going to need more carbohydrates and more starches, whether it's squash or sweet potatoes or other healthy carb sources. So you're probably going to need some level of carbs. Now, some people can still be spitting out ketones even with carbs at the 200 to 300 gram per day because they're just burning up. Think about those carbs. They're not really getting a chance to be stored that much because the body is constantly burning them, and their muscles are so, let's just say, they're so hypertrophied and stimulated that they're always emptying their muscles. So there's a constant reservoir for the carbs in their muscles or to be burnt up right away. So they can still maintain a lot of ketones, even with higher carbs. And again, it's going to be different from, if you're a wide receiver and a running back versus a alignment, right? So you have to look at all the position play on that. But I think there's some level of carbs are going to be great. I think there's a good video or a good article on Joe Thomas, who was a lineman for, I think it was the Bengals. And he played out at University of Wisconsin, I think. He was like a first-round pick. He played for 10 years. He was like 6'4", 320 pounds, and then now he's down to like 220 pounds, and he's full keto. He had to really eat tons of carbs and eat tons of food all day long to maintain his weight. So some can do it easily. Some really have to be on top of the diet to be there. Rami, you're totally welcome for that information. Hope that helps. All right, last question here coming up. Who wants to put it in? Let me know. So getting back to the meat thing, yeah, quality, what else you're eating it with, and then the fact that old foods don't cause new disease is very, very, very important. All right, guys, I'm going to sign off here. Hope you guys have a phenomenal day. Put your comments down below. Let me know what you think. If you're enjoying it, give me a share. I'll be back definitely on Friday morning. I wasn't last week because I got caught up with something. I'm going to create some content here right now on my lunch break before I start seeing patients again. So any feedback on topics, put it down below. Y'all have a phenomenal day. We'll talk soon. Take care. Bye.